Hi, this is Coach Kim with Joyful Living with Kimberly Dixon. I'm coming to you today from Duke Medical Plaza in Raleigh, North Carolina. I'm here today to have my pre-op with Dr. Comstock for my right knee total knee replacement on next Tuesday. I'm at exactly 7 days out. I'm so excited and just ready to get this process started. So today we'll do an EKG and any other tests that are necessary to make sure that I'm in good health before my surgery. I'll also visit with the anesthesiologist. And as I spoke about in one of my previous blogs, I will also speak with a representative from the hospital because I called my insurance company this morning, and guess what? My authorization has not been sent in yet. So I need to make sure that that is taken care of before I leave the campus today, because the last thing I want to happen is to get to Duke Raleigh Hospital on March the 24th and have my surgery postponed because I don't have the proper authorization. I will be posting updates throughout today to let you know what's been done and how the updates are going. Thank you. Well, my pre-op visit is now over. I've met with my surgeon. I spent a couple of hours in the pre-testing area where I had an EKG done, some blood work drawn, and an extensive family history completed, as well as what to expect. I was also signed up to go to a class for orthopedic surgery, what to expect. They gave me a wonderful checklist that allows you to go through your home to see what kind of obstacles you may have. And I hadn't really actually thought about that because inside my home is fully set up to accommodate me, but I do have steps leading into it. So that factors into your ability to get around once you get out of the hospital. She also informed me that I'll have a case manager who will arrange my home visits before I leave the hospital, and lots of great information. In addition, the lady who was handling my pre-authorization finally did contact my doctor's office again. Unfortunately, once she began working on the case, I was at the pre-testing center and it wouldn't allow the receptionist to check me in because somebody was working in my case. So I had to sit there for about 30 minutes before they could contact her. She didn't answer the phone. So just little issues of that nature is why you have to stay on top of things when you're having surgery done, because it requires coordination on many different parts. And between my insurance company, the doctor's office, the hospital, you don't want to get to the hospital the day of your surgery and these things not be in order. So I know I probably got on her nerves today, and that was not my intent. But I need to make sure that when I arrive at the hospital on March the 24th, that they don't send me home because I don't have the proper authorization for my surgery. So again, on tomorrow, I'll call my insurance company to see if they've received the paperwork. And if they have, then my work is done. If they haven't, then I'll be calling the hospital again to speak to the young lady who is handling things on that end. And this is not to be picky or to not to get anyone in any trouble. It's just to make sure that things are in order for me, because I am the one that's responsible for taking care of me, and that is exactly what I'm doing. So I'll be touching base with my insurance company on tomorrow to make sure that things are in order. Again, my pre-testing is complete. I'm gonna stop and get some lunch, and then I'm gonna go home and do some more work. This is Coach Kim with Joyful Living with Kimberly Dixon. I will talk to you soon.